My name is Angela Black and I'm a student at Bellevue University. Over the last few sessions, we've been assessing topics including depression, anxiety, and suicide ideation. I have the results of your assessments and it's time to talk about those now. The first assessment was the Beck Depression Inventory, and this assessment was chosen because it's one of the most widely used tools for detecting depression. And you were given the opportunity to consider statements that best describe symptoms of depression that you may be experiencing. You scored a 32, which puts you in the severe range. That equaled a T-score of 88, which compared to the average group number of 50. So that 88 T-score actually put you in the 99th percentile and hence the severe range. The second was the Beck Anxiety Inventory. This again is a widely used tool for detecting anxiety independent of depression, and you were given the opportunity to utilize a scale of 0 to 3 to rate descriptive items of subjective, somatic, or panic-related symptoms of anxiety. You scored an 18, which placed you in the moderate range. And on a T-score of 72 placed you in the 95th to 96th percentile. The third assessment was the Beck Hopelessness Scale. It measures hopelessness and identifies individuals who may be at risk for suicide. Three aspects of hopelessness that this assessment measures are feelings about the future, expectations, and loss of motivation. You scored a 13, and that score placed you in the moderate range. Your T-score was a 76, which put you in the 97th percentile. The final assessment was the Beck Scale for Suicide Ideation, and this was chosen because it helps measure the severity of suicidal ideation, things like thoughts about it, and if there's a formulated plan, things like that. You had a raw score of 2. Now with this assessment, it actually comes in two parts. The first 5 questions are used as a screening tool. And so if an individual scores in a 0 risk based on those screening questions, they do not have to then go ahead and finish the rest of the assessment, and it saves everyone a little bit of time and effort. This was the case with how you scored. As a 2, you then did not complete the rest of the assessment because this suicide ideation scale showed that you had no current suicide intent. I recommend that we go ahead and finish that assessment because the rest of your assessments placed you in the moderate to severe range, and I think that it's good at this time to further investigate that contradiction between those severe moderate ranged scores and your BSS response, which stated that you had 0 risk for any suicide at this time. So this is where I feel treatment should focus at this time.